I want to talk about what causes bipolar disorder. There really isn't a simple answer to that because several factors play a part in the onset of the disorder. Research shows that the risk for bipolar disorder results from the influence of biological factors acting together with environmental factors. We call this the stress vulnerability model. In order for a person to develop bipolar disorder, he or she must have some biological vulnerability for the disorder. How vulnerable someone is will vary from person to person depending on several factors which I'll talk about. Stress has an impact on this vulnerability and can either trigger the onset of bipolar disorder or worsen its course. First, let's talk more about biological vulnerability. Biological vulnerability is based on both genetics and other physical factors. Let's talk about genetics first. A family history of bipolar disorder does not necessarily mean children or other relatives will develop it. However, studies have shown that bipolar disorder does run in families, and a family history of the disorder is one of the strongest and most consistent risk factors. People in the general population have about a 1% chance of having the disorder. First-degree relatives, such as a child or a sibling of someone with bipolar disorder, have a 5 to 10% chance of developing the disorder. The risk is highest for an identical twin of a person with the disorder. The identical twin has a 40 to 70% chance of developing it. There are also non-genetic biological factors that can increase vulnerability. Biological vulnerability increases with alcohol and drug abuse. An imbalance of neurotransmitters can also increase biological vulnerability. Neurotransmitters are brain chemicals that communicate information throughout the brain and the body. An imbalance of the neurotransmitters norepinephrine and serotonin has been linked to bipolar disorder. While the exact role of these neurotransmitters in the disorder is unclear, we know that medication can affect these neurotransmitters and can lessen symptoms and decrease the chances of relapse. We'll talk more about the medications for bipolar disorder in part 7 of this series. Let's now move on to the stress part of the stress vulnerability model. As I said earlier, environmental stressors have an impact on vulnerability and can either trigger the onset of the disorder or increase symptoms. Stressful life events such as death of a loved one or loss of a job are risk factors for the disorder. Keep in mind that stressful life events don't necessarily have to be negative. Getting married or having a baby are examples of positive events that are also stressful. Additionally, a stressful environment can include chronic stressors such as sleep deprivation or negative family relationships that involve feelings of anger or hostility among family members or frequent arguments between them. Now let's put all this information together and combine biological vulnerability and stress. Take a look at this graph. Amount of biological vulnerability is on the bottom, and amount of stress is on the left side. People on the bottom left are those who do not develop bipolar disorder, and people on the top right are those who do develop bipolar disorder. Looking at the left side of the graph, you can see that people who have no biological vulnerability to bipolar disorder won't develop it, even if they experience tremendous stress. As vulnerability for the disorder increases, less stress is needed to bring about the disorder. That wraps up our discussion of the causes of bipolar disorder. We touched on the main risk factors for the disorder, including biological and environmental risk factors. Join me next time as we talk about the onset and course of bipolar disorder.